Hi, Mr. Johnson. I'm Tori with the Respiratory Care Department, and I'm here today to do some suction for you. We're going to do that suction to clear those airways for you. So we need to do two things. First, we're going to insert a nasal airway, and then after we do that, we will go ahead and do the suction. But before we get started, it's really important that we hyperoxygenate you so that you're able to withstand this procedure. So to do that, we're going to put a non-rebreather mask on you for about 30 seconds, and I'm going to have you take some nice long deep breaths, and that's going to hyperoxygenate you, and then this procedure will be much easier for you to withstand. So I'm going to go ahead and wash my hands here, and we'll get started. So the first thing that I'm going to do is put my non-rebreather mask on my patient. This will have a bag on it, and I'm going to get a nice seal, and I'm going to have my patient take several deep breaths for about 30 seconds so that we get lots of oxygen in the airways. And I had already went ahead and washed my hands here, and I'm going to put on some gloves. And we need to pick a size of nasal airway. So I should have done that first, but what you need to do is you measure from the nose to the tip of the ear to pick the size of the nasal airway, and then we're going to put just a little bit of Surgilube in the palm of one hand, and then we're just going to run the nasal airway through that so that we can cause less trauma to the nasal airway. So to insert this, the beveled side needs to go toward the septum. And then we'll just go ahead and insert. And we don't ever force that in there. Okay, so we've got our nasal airway placed. Now what we need to do is we're going to open our sterile catheter suction kit, and we're going to put on our sterile gloves. And then we're going to fill our suction catheter tray with some sterile saline so that we can check for proper suction, but also so we can clean out the catheter when we're done. So we have the sterile solution in our tray, and because this is an adult, the suction needs to be at 120 to 150, but we need to go ahead and test that. So with my sterile hand, I do have some lubricant on the catheter, and that's going to get kind of like wrapped around my hand here, and then this end is going to get hooked up to the suction. And then I'm going to put my catheter in the saline and occlude the thumb port so that I can see if the suction's correctly working. And then once it is, and we've got lubricant on the catheter, I'm going to go ahead and feed the catheter into the nasal airway. And then once I can see that the patient is breathing and I can see like condensation inside the catheter, I know that we're in the trachea, and also like if the patient would cough. And then once I've reached inside the trachea, I'm going to occlude the thumb port, and I'm going to suction out the airway, and that should take less than 15 seconds. And then to clean out the catheter, I can put that through the sterile saline and kind of clean that catheter as well. And with my non-sterile hand, I'm going to take my non-rebreather, and I'm going to re-oxygenate my patient after this procedure is finished, and of course clean up my airway and dispose of everything properly. Now, because my patient is being oxygenated after this process, it'll be for about a minute, and then since my patient is going to have suction several times, I'm going to leave in the nasal airway so that we cause less trauma to the nares.